This is something that Greg Mader has done most of his life.
I was diagnosed with type 1 diabetes in 1971 when I was 11 years old.
Check his blood sugar levels. People with diabetes have to test those levels frequently with the glucose meter to make sure they're not too high or too low. Based on the readings, they can make adjustments with medication. But Greg's wife, Rose, a diabetes educator, has a warning. Check your meter's accuracy often.
Because patients check their blood sugars anywhere from 1 to 6 times a day or more, and their therapy, how much insulin they give or not give, all depends upon their level of glucose control. So if their meter isn't reading right, it could make their therapy off. They could get too high, too low. It wouldn't be good results for the patient.
To measure glucose, put a drop of blood on a testing strip and insert it into a glucose meter that reads the sugar levels in the blood. But if those strips have been compromised, the reading could be off.
All of the strips have an expiration date on them, so you look on the vial of strips and see what the expiration date is. They all need to be stored in that container that they came in because there's a drying agent to keep them from getting too moist, and they can't be frozen, they can't be too hot, they can't be left open and expect them to work. So you have to maintain integrity of the strip.
She recommends patients consistently use a control solution. That is basically a measured amount of sugar water. You put the solution on the strip where you would put your drop of blood and then into the meter. If the meter reading does not match the number on your control solution bottle, you know you have a problem.
When you get diagnosed with diabetes, or you're starting a new therapy, or maybe you're learning to check your blood, I think the patients get really overwhelmed.
Which is why a reminder to check your equipment is crucial. Holly Furfer, CNN, Rochester, Minnesota.